The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. My name is Denis Thompson. I'll be your host. For those of you who would like to call in, I've been asked to give the number, and that is 888-565-1470. And you can call if you have a question, and we'll try to get your question answered on the air. If you'd like to ask a question via the Internet, just simply go to your browser and type in painmanagementnetwork.com, and you can ask any question. I'd be more than happy to answer it on the air in future shows. Well, we've had a very, very busy week. We've had a tremendous number of doctors contact us after the show here, and we're really curious to kind of what the system is all about. And for those of you who are new, I'd like to introduce you to neurotherapy, the ARP Wave System neurotherapy. If you're in pain right now, if you have restricted range of motion right now, if you've just come out of surgery or been out of surgery for a while and are not getting the results that you would like to get, you're not being able to be active, you have pain, you have restriction in motion, if you've been told you need surgery, neurotherapy may be something that you need to look into. And let me explain why. Wherever you have pain, wherever an MRI shows you have a problem, wherever an X-ray shows you have a problem, wherever any type of diagnostic imaging or testing tells you have a problem, that is where the problem ended. It is not where the problem is coming from. And the majority of practitioners have been trained in the physiology of the problem. So where you have pain is where you'll usually be treated. With the ARP Wave System neurotherapy, we are treating the origin of the signal that is causing the pain, not where the signal is ending up. So in other words, you're not going to solve a problem if you only work on the end of the problem. You must find the origin of that problem. And many of you who fall into that category of pain, restricted range of motion, many of you have tried everything underneath the sun, I'm sure. You've tried different medications, you've tried different doctors, you've tried different surgeons. But what you haven't tried is neurotherapy. And now we're making it available to you. And this therapy deals with the origin of your problem, not your problem. So if you're bone on bone, and the doctor says they need to put a new joint in, and they put a new joint in, and you still have pain, or you have to have another surgery, there's a reason for that. And that is the doctor did his job or her job, and that is to replace the joint. But ask yourself the question, why did the joint need to be replaced? And it's not because you were too active. It's not because you overworked it. It's because your muscles, neurologically, not physiologically, did not do what they were supposed to do and probably haven't been doing it for years and years and years. So if the muscles cannot absorb force, then that force is going to be transmitted to tissue that's not designed to absorb that force. And when that happens, you are going to have pain and you are going to have a problem. So the ARP Wave System neurotherapy is a new type of therapy. In patients, we have doctors who will show you and give you a treatment at absolutely no cost or obligation to show you if neurotherapy can help you or not. And the only way you're ever going to know is to try it. And if it costs you nothing to try it, it isn't going to hurt you. FDA authorizes it, so that means it's proven to be safe and effective. If you have no risk, why not do it? So for the practitioners and the providers and the doctors listening to the show today, we have a lot of patients who would like to try neurotherapy, and they'd love to do it in your office. And as a provider, we will supply you with those patients. And if you're a patient and your doctor does not offer neurotherapy, then offer him or her the opportunity of having you treated in their facility, no cost, no obligation to either of you, to demonstrate the efficiency and the effectiveness of adding neurotherapy to their existing therapeutic procedures. So just what is neurotherapy? Well, it's a system, and it's a system built around the neurological component of all pain and all injury. And it has three parts to the system. The first part is, since it is a neurological therapy, is to determine, is the nervous system working or not? And when we say working, what we're talking about is the nervous system sending the appropriate electrical signal to your muscles to allow the muscle to absorb force? Not to make it strong, to absorb force. And there's a huge disconnect between those two statements, strength and ability to absorb force. Just because you're extraordinarily physically strong does not mean you can absorb force. Look at the National Football League. Most of those men are very, very strong, but yet they still have a tremendous number of injuries. There's a reason. They're very strong, but they can't absorb force. And if you can't absorb force, you're going to get hurt. Just that simple. So the first step is to determine, is the nervous system sending the right signal to the muscle to allow it to absorb force? The second part of the system is to neurologically find out, to scan the body with our proprietary tools, to scan the body to find out exactly where the neurological disconnect is. And for the providers, that's where the sodium-potassium leakage is. We'll find that, and we're going to find the origin of the signal which is causing the symptom of pain or restricted range of motion. And once we find it, it's almost instantaneous as far as the results go and the relief goes. And then the third part of the system is simply to develop the body's ability to absorb force more efficiently. So it's a three-part system, and it works on the neurological component. So if you are in pain right now, right this second, and you have changed your pattern of movement, you know it, and everyone else around you knows it. Example, if your right leg hurts, you are going to shift all of your load and weight to the left leg. And when you do that, you've created a neurological compensation pattern. No amount of physical therapy, no amount of occupational therapy And no amount of medication is going to change the fact that you have a neurological pattern. Example, if it hurts on the right and you shift everything to the left and you go to an anesthesiologist and they give you a shot and it basically numbs your right leg, did you stop moving everything over to the left? No. Why? Because even though you don't have pain, even though you don't feel you have pain, you've done absolutely nothing for the neurological component of the process, and your brain still thinks there's pain, so it's going to shift everything over to the left side. So until you change that movement pattern, until you break all of those patterns, you will not solve the problem. Because every time you move incorrectly, you're sending a neurological signal that there's a problem. Whether there is or isn't, you're still sending the signal. And you get caught in that loop. So what neurotherapy does is it neurologically retrains you, the patient, on how to move efficiently without a neurological compensation pattern, using the muscles correctly to absorb force so the force stays out of the area, and consequently you will have very little pain, if any. Now, if you want to see how important it is to shift force, if you have back pain right this second, and you're sitting in a chair, and you get out of that chair without ever seeing you, I can tell you how you're going to get out of that chair. You're going to lean forward, and the minute you lean forward, all the force goes directly to your lower back. You're going to use momentum to get up, so your knees are going to go over your toes. At that point in time, all the force is going to your knees. When you stand up, you have a hard time completely standing up because the hip flexor isn't getting the proper signal to allow you to go straight up in the air or stand erect. So all of those things are neural patterns. And you cannot break those unless you break the neurological bond that's causing that pattern and causing that movement. And the second, and I'm telling you, the second you break that signal, your movement pattern will change immediately. Consequently, the muscles will do what they're supposed to do, which is absorb force. The force will stay out of the damaged tissue, no longer irritating that tissue, and no longer giving you the symptom of pain. But you know, this all sounds way, way, way too good to be true. We've treated over 75,000 patients all over the world with better than a 95% success rate. We know neurotherapy can help you. The trouble is, you don't know neurotherapy can help you. And the only way you're ever going to know if neurotherapy can help you is go to one of our practitioners and have a complete evaluation and treatment. And then, and only then, will you know if neurotherapy can help you have a better quality of life. I can tell you it will, but until you experience it for yourself, there's no way you will ever know. So listen carefully to how you, in the area, Florida, can get a free treatment to show you if it will work for you or not.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back, and welcome once again to Pain Free Today. My name again is Denis Thompson. I'm the host of the program. And I've been asked to discuss with you today chronic pain. And we deal with a tremendous number of patients worldwide with chronic pain. Some of the most severe and debilitating pain that we've seen in practice, in clinical practices in our clinics throughout the world, would be a condition called CRPS, and then followed just very closely behind with fibromyalgia. Now, we've also come across some other chronic pain scenarios, but those probably would be the two main areas. So the question is, how would and how does the ARP Wave System neurotherapy address chronic pain? Because it's just that, it's chronic pain. And if we had the answer to it, then why wouldn't every doctor in the entire world utilize our therapy? Well, that's a real good question. And I think the easiest way to answer that last question is to say that up until just a short while ago, we were a provider of these services. We had our own facilities, still do, all over the world, providing these services. And because of the climate and because of our deep burning desire to help more people, we've decided to stop being a provider of the services and set up the nation's largest network of doctors to provide our services. And we will train the doctor staff in our system, monitor that staff, and oversee that staff so they then can get the same type of results that we have received over the last 15 years. So how do we address chronic pain with the ARP Wave System neurotherapy? Well, the first step is we have to determine, is the nervous system doing what it is supposed to do in allowing the body to absorb force? Because if it is not, then that force is going to tissue that's not designed to absorb the force, which would be tendons, ligaments, cartilage, fascia, bone, et cetera, and it would be creating a reaction in the muscle, because the muscle would then go into a position of protection where the muscle bunches up. We call it concentric contraction, as opposed to when it is functioning and stabilizing you, where it's equal distribution between concentric and eccentric. When it's primarily in concentric, it's going to hurt, and it's going to consistently hurt. And if you'd like to know what that feels like, just simply flex your arm. And as you flex your arm, keep it in that flex position for about an hour. And then, because of the extreme amount of ache and pain in your arm, then immediately see what it feels like to elongate your arm or just stretch it out. Just go from a flex position into an extended position, and you're going to see how quickly those symptoms go away. Well, with chronic pain, the first thing that we have to do in the system is we do a complete evaluation. We do a complete history done in the doctor's office. And then we test the nervous system. And we test the nervous system by testing the muscles. The muscles are the outward expression of the nervous system. Now, let me say this. I have never, in 75,000 cases, never seen a patient who had chronic pain that was neurologically imbalanced. Never seen one. So if you're in pain, I can tell you your nervous system is not sending the right signal to your muscles to allow your muscles to act as shock absorbers, and henceforth that shock is going to go to places it's not supposed to go, and therefore it's going to exacerbate your pain. Now, that's number one. Now, most of these cases that we see usually result or are the end result of some form of trauma, whether it be an accident, whether it be surgery, which is a trauma to the body also. So if you are suffering from pain, and that pain came after a trauma or after a surgery, and it's been diagnosed as CRPS or RSD or fibromyalgia or any of those, then by all means, pick up your telephone, call your doctor immediately, and ask him if he offers, or her, ask them if they offer the ARP Wave System neurotherapy. If they do not, then you offer them the opportunity and ask them, your doctor, if they would be agreeable to having you be treated in their office with neurotherapy. And you can certainly give them the website, painmanagementnetwork.com, for them to do any research. And we will do a treatment for you in your doctor's office. And if your doctor says no, just give us a call. Give us a call locally at 954-256-0045. And we will get you an appointment with one of our providers in the area. They will be a medical provider, and they will take you through this first step and the second step, and that will give you a clear indication whether the neurotherapy, the ARP Wave System neurotherapy, can change your quality of life if you have chronic pain. So the first thing that we would do, as I said, is we would test your muscles. Now, how do we do that? We lay you down on a treatment table. We have you raise your leg up. You resist, and the practitioner will put very light pressure on your shin. If you're able to resist, that muscle turns on fast enough, well, then you pass that test, and we continually do that with most of the muscles in your body. I can assure you that if you have chronic pain, you are going to fail that test. And then once you've failed that test, we now know that your nervous system is that the number one reason you're having chronic pain? Have no idea, but we definitely know it's a piece of the puzzle. We know your nervous system isn't working correctly, so we use a therapeutic technique to basically turn those muscles on, which means get the signal going to the muscle to allow the muscle to do what it's supposed to do, which is absorb force. So the second step is that we would scan your body. And now you already know where it hurts. You don't need a test to prove to you where it hurts. And if it hurts all over the body, then we're going to ask you where it hurts the most. So if it hurts most in your back or your neck or your elbow or your foot, wherever, it doesn't make any difference. That's where we're going to start the scan. And as we scan you with our proprietary tools, which are patented and proprietary, we will identify very, very quickly where the neurological disconnect is. In other words, where that electrical signal is being disrupted. And there's not an EMG in the world that's going to tell you that. The EMG, which is called an electromyograph for the providers here, they know that. But for you, the patient, all that does is tell you that there's a signal going from point A to point B. It does not tell you if that signal is significant enough to do what it's supposed to do, which is turn that muscle on to allow it to turn on fast enough to absorb force. So the first test we do, identify, can you absorb force? The second thing we do, if you can't, is we basically send a external signal to the muscle where your brain can't send that signal, your nervous system can't send that signal, doesn't mean an external brain can't. So we're going to send that signal directly to that muscle to get it to do what it's supposed to do, which is absorb force. Step two is we're going to scan your body, and we're going to find exactly where the electrical disconnect is. Think of it kind of like an electrician. We're going to look for an electrical short. Now, if you're an electrical appliance, which you are, and there's an electrical short in your electrical appliance, do you think the electrical appliance is going to work correctly? No, absolutely not. If you have a short in your TV, if you have a short in your computer, it's not going to work right. Well, the body's the same way. The trouble is, we don't look at it that way. The trouble is that all of our providers, I won't say all, but most of our providers are trained in physical medicine. And they're extraordinarily gifted, extraordinarily skilled in physical medicine. They are not trained in the neurological origin of the problem causing the physiological symptoms. That's what neurotherapy is. That's why it is a perfect addition to every single doctor's practice in the country. Not only the country, but the world. We believe that wherever you have pain is where the problem ended, not where it's coming from. So as we scan your body with our proprietary tools, we're going to identify very, very quickly where that breakdown is. Once we identify it, we then now are going to start the therapy cycle. So if you come into the practitioner and you have pain of 8 or 9, my guess is when you leave, you'll have pain of 1 or 2. Now, that is not to say that you're cured, because in no stretch of the imagination are you cured, healed, or is the problem solved. All that does is tell you the way you feel after your first treatment is the way you can feel for the rest of your life, provided you go through the therapeutic process. Because every single day of the therapy, and there's 20 sessions in the therapy, every single day we are neurologically retraining your muscle to get out of a concentric contraction, protecting you, into a force absorption contraction, stabilizing you. So when you come in and you have a lot of pain and we treat you in this first treatment, we've taken your muscle from being a balled up fist to a relaxed open hand. However, within about an hour to an hour and a half, because you've had this for many, many years, I would imagine, that muscle is going to go right back to where it feels comfortable. And if that's where you stop, and you don't think it worked, well, you are going to be missing the greatest advantage of your life. Listen carefully to how you can see for yourself if neurotherapy can help you.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. When we left off, we were talking about What happens after your first session? You feel great. You think you're cured, you're not. And again, all that happened is, in the therapy session, we took your muscle from being a concentrically contracted muscle and allowed it to go to eccentric contraction. That immediately takes all the pressure off. Again, if you recall what we talked about earlier in the segment, if you flexed your arm and kept it there for an hour and then straightened it out, that's what we did. We straightened that muscle out. We allowed it to absorb force, and we allowed it to go into the position that it should have been going into for a long time. It is going to go back into that concentric contracted position. And every time you go to therapy, every single day, you are going to be lasting longer and longer and longer without pain. So you'd be the judge. After your first treatment, if you feel less pain, and if you feel what I call mobility pain, if we've gotten you down in that first session, which in 95% of the time we will, if we bring your pain down to 1 or 2, then that's exactly how we can get you after therapy. Not today, not tomorrow, but 20 days from now, that's how you will feel. Because every single day, it's going to be a longer and longer and longer period of time before that muscle goes back to its normal concentric contracted position. Because that's homeostasis. That's where it feels comfortable. By the end of 20 sessions, it will no longer feel comfortable there. It will only feel comfortable working normally, eccentric and concentric, not protecting you, not stabilizing you, but doing both. Only when it's heavily protecting you are you going to be in pain. When it's stabilizing you, you're in no pain. We're going to neurologically retrain you how to move efficiently. We're going to neurologically retrain the muscle to function as it's supposed to function, where force coming in is absorbed by the muscle, not your tissue. And when that happens, you're going to have a quality of life that you could only dream of right now. So that's kind of how we would address chronic pain. Another question that's been asked numerous times on the website, and that is, Dennis, what do you do for pre-surgery? My doctor has told me that I need surgery. I'm bone on bone. I need surgery. I need surgery on my knee, my hip, wherever, or I have a tear and I need surgery. How can the ARP Wave System neurotherapy help me? Well, the answer is very clear, and that is, how did you get to where you're at right now? How did you get the tear? Well, I was playing football, or I was out in the garden and I twisted wrong, or I fell, or whatever. That is not why you need surgery. That's the impetus which caused the end result. But the end result is caused by an origin of a signal from your nervous system which did not turn those muscles on fast enough to absorb the force, so the force went to tissue. So if you have a torn tendon, ligament, cartilage, whether it's an athletic injury, whether it's an automobile injury, whether it's a falling injury, makes no difference. All that says is, unless it's an automobile accident, of course, where the force was too great for the muscle to respond to, that your nervous system did not do what it was supposed to do and turn on those muscles fast enough to absorb that force. So now that force went into the tissue and it tore the tissue. Now, if you're bone on bone and the doctor has shown you, look, you're bone on bone, we've got to do surgery if you can't handle this pain anymore. Well, that's 100% true. You definitely need surgery. If you are going to have that surgery, the doctor's going to want to have most of the swelling down before he does the surgery, and most of our surgeons listening today would agree to that. So how is the ARP Wave System neurotherapy going to help that? Well, again, everything starts with the system. The first thing that we do for every single case, whether it's chronic pain, whether it's a surgical issue, whether it's a post-surgical issue, whether it's an ankle sprain, doesn't make any difference. The first step is the first step, and that is we have to determine, is there an electrical short? In other words, does the nervous system send the right signal? If it doesn't, we're going to go in and do surgery, and all the force is going to keep on going right into the same spot. Now, that doesn't make a great deal of sense. Now, if you had joint replacement surgery 15, 20 years ago, my guess is you're staring joint replacement surgery in the face again. And if that's the case, ask yourself why. Why did that new joint deteriorate? Well, the answer is very simple. The force, which is supposed to be going into the muscle, is now going into the new artificial joint. Henceforth, you now need a new artificial joint. Or do you? Put a new joint in, the same thing's going to happen. All the force is going to go to the new joint. Doesn't it make sense to kind of redirect the force? That's what the ARP Wave System neurotherapy does. It redirects the force. But the first thing we have to do is make sure the signals are correct so the force goes to where it's supposed to go and the muscle does what it's supposed to do. So the very first thing we do for a pre-surgery patient is we will put them through the system. We will muscle test them. We will put them in balance if they need to be in balance. And what that means is we'll fire those muscles with an external proprietary tool to get those muscles firing to where they absorb force. In the process of doing that, guess what happens to swelling and inflammation? Well, as long as you're not continually irritating that tissue, as long as you do our proprietary techniques, that swelling will be gone probably a day, 2 days at the most. And then you're now better prepared for that surgical intervention. The muscles are better prepared for that surgical intervention. And what you've done is you've cut about 6 to 7 months of rehab off the back side. Let me give you a story. I had a hockey player who was involved in an automobile accident and did significant damage to his knee. And his surgery was scheduled for about 10 days out. There was a tremendous amount of swelling, so the surgeon did not want to do surgery until most of the swelling was gone. So he went into the ARP Wave System neurotherapy program, and in 3 days' time, all the swelling was gone. Most of the range of motion had been regained. When he did go to surgery, which would be 10 days later, his soon-to-be surgically repaired leg was just about the same size as his non-surgically needed leg. And consequently, the surgeon was quite impressed and did the surgery, and it was relatively easy surgery. Now, this player had a teammate who had gone through a similar surgery without going through the ARP Wave System neurotherapy program. And he was 3 months post-surgery. And at that point in time, 3 months post-surgery, he was on a bicycle, and he was riding a bicycle, a stationary bicycle, and able to do pool work and things of that nature. Well, to make a long story short, after the individual, the hockey player who was involved in the auto accident, had the surgery, 3.5 days after the surgery, 3.5 days, not months, 3.5 days after the surgery, he was riding a stationary bicycle with virtually no pain. He was on our proprietary tool while he convalesced in the hospital, and when he came home, he went immediately into the in-home therapy overseen by the doctor. And the doctor was utterly amazed, and so was the team, because here was a classic example of almost the same surgery, the same type of athlete, and one 3 months out was just barely able to ride a bicycle without pain, and one 3 days after surgery was that much further ahead than the 3-month post-surgery candidate. So can the ARP Wave system help you if you are going to have surgery? Absolutely. How it helps you? Very simple. First thing it does is it allows your muscles to do what they are supposed to do, which is turn on fast enough to absorb force. So let's say you have a tear. Let's say, again, you're bone on bone. All that force is consistently going into that damaged tissue. If we redirect that force no longer is irritating that damaged tissue. So the swelling, utilizing our techniques, that swelling will dramatically go down. So much so that within a day to 2 days, all the swelling should be gone. Now, can that help you? Obviously, it certainly can help you. But more importantly, after the surgery, that force now is going to be going to where it's supposed to go, not to the new surgically repaired tissue, which means you're going to heal much faster, which means there's going to be more blood supply to that area, which means you're going to have better range of motion, which means your muscles are going to not have post-surgery atrophy, which is a huge problem. So in the pre-surgery process, if you've been told that you need surgery for whatever reason, orthopedically that is, or neurologically for that matter, if you've been told you need surgery, pick up your telephone after this show today, call your doctor, and ask your doctor if you can be treated with the ARP Wave System neurotherapy in his office or her office prior to surgery. We will do that one time only. No cost, no obligation, to show you and your surgeon how important this therapy could be for the surgeon's practice and how important it can be for you in the surgical aspect of what you're about ready to face. And again, there's no cost, no obligation to either of you. If your surgeon says, no, I'd really rather not do that, give us a call, and call us at 954-256-0045, and we will get you set up with one of our providers to take you through a session to demonstrate to you the efficiency of this system. We only ask that if you see the difference, do you agree to be treated by our provider? It's just that simple. It's covered by insurance, and it will make a tremendous difference in the surgical intervention you're about ready to go through. Listen carefully to how you can try neurotherapy at no cost and no obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com. and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back. I am your host, Denis Thompson. This is Pain Free Today. And we were talking about how the ARP Wave System neurotherapy could help someone who's been told they need to have surgery. How about someone who's already had surgery? Can the ARP Wave System neurotherapy help someone who's just gone through surgery, who has gone through surgery maybe months and months ago and still are facing challenges of pain, restricted range of motion, all of those things which normally associate themselves with a surgical intervention? Well, the answer is yes. We've worked with literally thousands and thousands and thousands of some of the world's leading athletes, as a matter of fact, on a post-surgical basis to dramatically shorten their recovery times, so much so that it's almost too good to be true. And we could get into that, and we'll get into that in a few minutes here. So how would the ARP Wave System help you, the patient, after surgery? Well, again, as we've been saying for the last 8 shows, everything starts with the system. The very first thing that we do, even though you come out of surgery today, the first thing that we would do is we would determine, is your nervous system sending the right electrical signal to your muscle to allow the muscle to absorb force? If it isn't, you're going to have a long, long recovery period. A very long recovery period. And let's look at that. In athletics, it's normally, or even in non-athletics, an ACL repair, a reconstruction of the knee, is going to take anywhere from, if you're really, really, really aggressive, 6 months, and if you're average to aggressive, 9 to 12 months for recovery before you can resume an active lifestyle, and you happen to be an athlete until you can resume athletic activity. Why does it take so long? You ask any surgeon, and I'm sure we have surgeons listening today, why does it take so long? It takes so long because it takes that long to heal. That will be the answer. It just takes that long for tissue to heal. That's true unless you are utilizing the ARP Wave System neurotherapy. So what's the difference? The difference is, in a nutshell, force absorption and blood supply. When you go through surgery, which is a tremendously traumatic event for your body and your muscles, what happens is that your body is in protection. Your body is going to protect you. And it's going to protect you by allowing the muscle to be in a concentric contracted position, which therefore is going to restrict blood supply. Now, any surgeon and any doctor knows that if you could increase blood supply and take force out of damaged tissue or surgically repaired tissue, that tissue would heal very quickly. The trouble is there's not a lot of knowledge on how to do that. As a matter of fact, most people believe it can't be done. That's because they have not been introduced to the ARP Wave System neurotherapy. Here's how it is done. The first thing we do, just like we said before, everything starts with a simple test. Is the nervous system working to send the right signal to the right muscles to allow them to absorb force? Example, if you have a bad knee, for whatever reason, the force is going into your knee. It's just that simple. So if you take the force out of your knee and put it into your muscle, do you honestly think you're going to feel it in your knee? No, not at all. You're not supposed to feel it in your knee, whether you had surgery or not. So as a post-surgical candidate, if you've had surgery anywhere in your body and you still have restricted range of motion, you still are not able to do what you want to do, you still have pain, you need to call immediately your surgeon and ask them if they would allow you to be treated in their office with the ARP Wave System neurotherapy. We will basically send your surgeon everything they need to have you be treated in their office. We will oversee that treatment and demonstrate to you and the surgeon that this therapy should be added to their practice. And if we do what I say we will do, and if you see a change as the patient, then we just want you to tell the doctor that you'd like to be treated with this. It's going to be billed to insurance. So it's a win-win for everyone. But again, there's only one way you're ever going to know for sure if this therapy can help you after surgery, and that's to try it. Now, we've got doctors that are utilizing our system in a recovery room. And then when the patient goes into their hospital bed for a day, 2 days stay, they have the system on, and our proprietary tools and techniques are being implemented. And when they get out of that hospital and they go home, their therapy is overseen by the doctor's staff while they're at home, requiring no visits to physical therapy, occupational therapy, in-home therapy, no heavy medication needed. Why? Because they're using the ARP Wave System neurotherapy. Now, why is it such a difference? It's such a difference because we get the muscles to do what they're supposed to do, which is absorb force, and we flood that damaged tissue with blood. And those two components will drastically speed up any orthopedic or neurosurgical intervention, period. Now, for the surgeons listening to this, how can the ARP Wave System neurotherapy eliminate one of the biggest obstacles that every surgeon in the world has, and that is post-surgery atrophy? Why do you suppose there is atrophy after surgery? Why do you suppose that no amount of physical therapy, no amount of exercise, no amount of occupational therapy, no amount of personal training changes that atrophy to an extent? Why? Well, if you ask yourself that question, it can't be a physiological answer. It can't be because they're not doing enough exercise. What it can be doing, or what the answer could be, is the muscle is not neurologically firing the way it's supposed to. And no amount of physical stimulus is going to change that. Only a neurological stimulus will change that. So, I'm going to make some statements. I'm going to tell you some stories about people that we've treated in a post-surgical environment. Okay, so let's talk about athletic injuries. If you're an athlete and you're listening to this program today and you've had an ACL surgery, I can tell you that it took you 6 to 9 to 12 months to get back on the field and be able to do, or on the court, or in the pool, or wherever your athletic endeavor is taking you. I can tell you it took you that long to recover. And I can also tell you that had you gone through the ARP Wave System neurotherapy, you would have been competing within 8 to 10 weeks with zero post-surgery atrophy. Now, how can I make that statement? It's real simple. We've done this over 20,000 times. I know what the results are going to be. The only difference is, like we said earlier today with chronic pain, you don't know what the results are going to be. And until you see them, until you experience them, you will never know. And there's only one way for you to ever find out if this therapy is going to be able to do what I say it does, and that's for you to try it. So if you're an athlete, if you're an individual that just had surgery, if you just had a joint replacement, if you are in physical therapy and you're not getting where you want to go, there's a reason. And that is more than likely, your nervous system is not sending the right electrical signal to your muscles to allow them to do what they're supposed to do. Now, what does that mean? Well, the patients say to me all the time, well, I'm in physical therapy, I've got my personal trainer, I'm strong, but I just can't do what I used to be able to do. My muscles just aren't acting the way they should act. They're not acting that way because there's an electrical short. Well, we're up to time today, but to find out if neurotherapy can help you, give us a call at 954-256-0045. Until next week, this is your host, Denis Thompson, and have a pain-free day.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.